Ohio's 17th District Senator David Daniels, a Republican of Greenfield, and 86th District Representative Cliff Rosenberger, a Republican of Clarksville, held an open-door session Friday at the Highland County Administration Building and discussed pending state budget issues, funding for local programs, and economic development and growth with area constituents. Heather Gibson, of the Help Me Grow program of Highland County, spoke about the funding issues the agency is facing while dealing with an influx of clients. In particular, children suffering the effects of parents addicted to drugs.
Now, if you look at 200 Part C kids and 53,000 that we get from the federal government to cover those kids, you can't make those numbers work. I mean, there's just no way of making 53,000 stretch across 200 kids. And we've had such an influx of babies that are born addicted to drugs that it really is taxing the whole community. Because we're a small community, we're not like a Cincinnati or Columbus where we can farm out a lot of the resources to the local children's or other areas. We do it all in this county. Many of our families have issues with transportation, so getting them to a children's is quite, it's an obstacle. So I did check with Children's Services, and in 6 months, the last 6 months of last year, they got 97 referrals for kids just related to drug abuse with the parents.
Say that one more time, please. 96 kids?
97.
97 kids.
In the last 6 months of the year. That is much more case intensive for us because oftentimes we're placed with foster parents or a lot of times relative placements that have no idea how to deal with these kids. I mean, a baby born addicted to drugs is unlike any other, and each one of those are different depending on when the abuse began in pregnancy or how often, what type of drug, and all those kinds of things. So we're really trying locally to address the issues, but I can see as the funding cuts, it's really going to hurt us because we're not going to be able to make up that difference where some of the other bigger counties can with the Medicaid money. And to be honest with you, we're the ones that everybody else calls in to deal with these babies. Nobody else has the experience. We save babies at a much smaller gestation than we ever did before. So we get 23-week babies on our caseload. Nobody else can really deal with that. I mean, Children's Services calls us in with the drug babies because they don't have any advice for those parents and things. They don't know. As far as like medically, the local hospital, their therapy list, there's such a waiting list. I've had kids on there for a year and haven't been seen yet. I mean, we're talking about babies that cry 23 out of 24 hours of the day sometimes, just because they're going through withdrawals and things.
We understand the challenges that you're facing on the local level, we really do. And as much as I hate to say it, I'm probably going to tell you that there's probably going to be very few state programs that don't see some reduction in funding available this year. Try to keep it in mind as it goes through, and believe you me, I understand from the district I'm from, I understand that not all counties are created equal, and there are resource gaps in a lot of our smaller rural counties that don't exist other places. So as we kind of start through this discussion, we're going to be looking not only we spoke about it here a few minutes ago. Not only are we going to be looking at the reduction of dollars that's going to be coming into these programs, but also we're going to try to find ways to help local people deal with it. And nobody knows these programs better than you. I mean, we talk about the programs that are in place, but you are the people that are actually delivering the service, and you understand where the problems lie and that. So if you have got any kind of advice or you've got any ideas that would help us find solutions for you with fewer dollars, I mean, we're going to be extremely open to listening to those through this budget process.